Hello, my name is John Barker and I am the Managing Partner at WMC Business Services LLC. This little video presentation is intended to explain why we feel that Willamette Dental Group is a very strong value in dental care for individuals and families in Oregon, Washington, and in Idaho. This little video presentation is intended to explain the individual plans that are available with Willamette Dental Group, but they're also applicable to their plans that are sold through a group or voluntary basis as well. Why is Willamette Dental Group different? First, Willamette Dental Group has two roles. They are the dental insurance carrier, but they're also the dental provider. They have a different philosophy than most dental practices. They take a proactive approach to dental care to save you money and your family, as also to keep the cost down for Willamette Dental. You will have a partner in determining the best and least costly course of treatment for you and your situation. They do proactive and evidence-based dentistry. Proactive care means Willamette Dental focuses on preventing disease rather than treating it surgically. Willamette Dental achieves this by practicing evidence-based dentistry based on the latest research and years of reliable science that leads to the safest and most reliable treatment available. They use alternative treatment choices for better care and lower costs. A couple of these are remineralization, is a process that helps teeth actually grow stronger so that a lesion does not turn into a cavity. Another is a pulp cap, which is a less harmful and less costly alternative to a root canal, which is often accompanied by a crown as well. The dentist will only decide to drill if one of the less invasive procedures may not be a successful course of treatment. There are some possible disadvantages of going with Willamette Dental. First, they have a limited dental network. You need to see a Willamette Dental dentist at Willamette Dental facilities. Dentists do leave Willamette Dental for a variety of reasons from time to time, and you may need to see a different provider when that happens. Limited emergency and out-of-area care when you travel, so you will want to ask the dentist in that area to temporarily treat the emergency and finish the treatment or procedure when you return home. Individual coverage also has waiting periods for major care. Why is there a waiting period for major care on individual dental? Most of the time people don't think of purchasing dental insurance until there's an issue and there's pain, which means that there's going to be immediate dental care necessary. Any individual dental plan will have a lower limit or restriction on major coverages for a specified period of time to protect the dental insurance carrier, and in this case it would be Willamette Dental. If the dental carrier did not limit the major coverage, there could be a tendency to cancel the individual policy once the problem is corrected, and that would be detrimental to the carrier and eventually to the patients when the dental plan is not viable. Possible advantages to you. There's no deductible. You have a copay every time you go to visit the dentist. There are no maximum benefits amounts. In most plans you might pay for a $1,000 benefit, but in this situation there's no limitation to that benefit. If you need extensive work, it will all be covered. There's also orthodontia and other specialists like endodontists and periodontists. There is extended hours at all Willamette Dental facilities, including Saturdays. If you have a group dental plan, we can also use the Willamette Dental individual plan to supplement your coverage or fill gaps you and your family may have. Here's an example of where I went to the Willamette Dental facility not too long ago, and they showed me the difference in what they call a pulp cap. Normally the procedure I had would go fairly close to the root, and the dentist talked to me beginning and mentioned that if she just drilled quickly, it would get really close to that. So she had to slow down and take a little longer time to make sure she did not go really close to the pulp cap, to the root. In that situation, she did not have to do a root canal. So in a traditional facility, I may have needed a root canal, because it was gonna, and that would normally cost me about $800 or more. And then a crown would have, in this situation, been necessary. And in my situation, if I would have had a 50% copay, I'd have been $900 out of pocket. But in this situation, the dentist took a little longer time, which was not necessarily beneficial to a traditional practice, but in the Willamette Dental facility, they get paid and rewarded for savings, both to me and to the facility. So the pulp cap was only $50. The office visit was $25. The filling was $25, and the antibiotic that was put on to the pulp cap before the filling was done, to give me a total of $115 out of pocket, which was a tremendous amount of savings to me, but in eventuality it's also a savings to Willamette Dental. Now, just in case I would have needed a crown and a root canal, this is what the scenario would have been. The traditional PPO method would have been the same. I would have had $900 out of pocket. But at Willamette Dental, this is the plan that I have in Washington at the present time. The office visit was $25. The root canal would have been $250 out of my pocket, and the crown would have been $400. Even if I did need a crown, I would have been $675 out of pocket instead of $900. I'll show you, just in case 2 root canals and 2 crowns were needed. Many times individuals do not purchase individual dental insurance until there are problems, and then sometimes there's more than one problem. It's not uncommon, if you go for a length of time without care, that 2 situations could be there. In that situation, in the traditional PPO, I would have only had a $1,000 benefit. And then for 2 crowns and 2 root canals, my out-of-pocket cost would be $2,600. In the Willamette Dental situation, still 1 office visit, 2 root canals would be $500, 2 crowns would be $800, and my out-of-pocket cost would be $1,325, which is about 50% of what my cost would have been on the traditional PPO plan. Now let's look at what the net benefit after the cost of the individual plan will do for each of these scenarios. This is an evaluation that I did for a client just a couple of days ago. He was on a traditional PPO plan, and his cost per month for that dental plan was $52 per month. So the yearly cost was going to cost him $624 a year for the premiums. The yearly benefit for that was going to be $1,000. So the carrier on that PPO plan was only at risk of $376. Now look at the Willamette Dental side. My plan right now costs me $35 a month, and that could change over time, but that's what it is today. My yearly cost is $420. My yearly benefit, I have no maximum. No matter what I do, I can get all the care I need, including orthodontists, specialists, you name it. I can get all the care that I need for that $420. Because of that, look at what's at risk for Willamette. Willamette has an unlimited amount of risk. If I have $10,000 worth of dental care needed, they're going to provide me with that. So in their scenario, it is to their best interest to work very, very closely with me as a partner in my preventative care and in taking care of my dental options at the lowest cost for me as well as the lowest cost for Willamette Dental. Who can benefit from the Willamette Dental Group program? For seniors who are on Medicare, Medicare usually doesn't cover any dental, or if they're on Med Advantage plans, some little bit of preventative dental could be added in on some of the plans, but regular care is usually not covered anywhere in Medicare. This gives the most amount of benefit for the least amount of cost for seniors who are on a fixed income. Students, the same situation. The most amount of benefit for individuals who sometimes don't have always the most amount of money coming in at that stage of their life. Self-employed and unemployed individuals, part-time, seasonal, or 1099 employees can benefit from the individual dental plan with Willamette Dental Group. Those on group plans that need additional care, once the care, if you have a tremendous amount of care that's needed, once your traditional dental plan that's offered by your employer has been exhausted, you can look to have a secondary option with Willamette Dental Group on this individual dental plan. And after the 6-month wait for the major things, everything would be covered as a secondary piece to your group plan. Basically, we feel that anyone with a need or desire for strong dental care can be benefited from the Willamette Dental Group plan as long as they're in your coverage area. If you have any questions about how we incorporate the Willamette Dental Group programs into what we are helping our clients with, controlling healthcare costs, controlling dental costs, please give us a call toll free at 888-334-2334, or send us an email at info@WMC Business Services.com. You can go to our website and learn more about not only the Willamette Dental programs, but all of the different programs we have that can benefit your family at www.WMCBusinessServices.com. And also you can visit the website for Willamette Dental Group at www.WillametteDental.com. We appreciate your time and look forward to your positive dental care. Thank you.